Hello and welcome. My name is David Whitesides, and I'm here to do a presentation on exercising with kidney disease. First of all, I want to thank you for taking time to watch this presentation. And secondly, I really hope you learned something from it. Thank you, and we'll begin. So, what is kidney disease? The American College of Sports Medicine has stated individuals diagnosed with chronic kidney disease if they have kidney damage evidenced by microalbuminuria or have glomerular filtration rate of less than 60 milliliters per minute by 1.73 meters per second for 3 months consecutively. You might ask, micro what? Glomerular who? Well, microalbuminuria, measures the level of albumin in your urine. And to break that down even more, albumin is a protein that the body uses for tissue repair and for growth. It's one of our best, might be even considered the best protein. Um, so we do not want our kidneys filtering that protein out. We want it to stay in our blood system so when we are exercising, we will be continuing rebuilding tissue. Um, the glomerular filtration rate is a urine test, nope, sorry, blood test that just tests how good the kidney is functioning um, in separating waste from the blood itself. Um, Also, regardless of age or race, anyone can develop kidney disease. Most of the risk factors are diabetes, high blood pressure, cardiovascular disease, and can be within your family history. The sooner the better to diagnose if you have kidney disease, because the sooner you can fight the disease, the better off you are. Uh, and if you have diabetes, your kidneys are checked for this disease yearly. What about healthy kidneys? According to the National Kidney Foundation, normal results range from 90 to 120 milliliters per minute, 1.73 meters squared um, GFR. Older people as we get older, our GFR will lower with age. Um, as the slide states, kidneys are a pair of bean-shaped organs located just below the rib cage on either side of the spine. Over to the left of us, we have a little bit of anatomy. We have the kidney, shows you the bean shape and it's cut. Then the nephron and the glomerulus, these show even more breakdown of where the filtration process happens. Not going to go into this too far, but just wanted to show y'all this is where blood goes in the glomerulus right here, where blood goes in and waste is filtered out. Not only are our kidneys our body's filter, but they do so much more besides filtering waste and excess fluids. They maintain our electrolyte balance in our human bodies. They produce hormones that regulate our blood pressure, regulate our red blood count, and keeping our bones strong. There's 5 stages of chronic kidney disease. I won't go through each stage as you can see, but it starts out and it's measured by the glomerular filtration rate. Um, Stage 1 being greater than 90, which is normal, and going down. 60 to 89 is stage 2, 30 to 59 stage 3, 15 to 29 stage 4. Stage 5 is kidney failure or you're on dialysis. And for y'all that don't know what dialysis is, it is simply a device that does the job of the kidneys. It's purifying our blood of waste products that we produce. Here we go. Exercise testing patients with kidney disease. I've listed 4 on the slide, but there are several more, and we will go over all of them. First and foremost, the doctor and the nephrologist should have cleared the patient for exercise testing. We should get these from the informed consent form and also letter of consent from the doctors. All their medicines they're using, and it should be similar to patients with hypertension and diabetes. So those testing protocols should be used mostly. And for older patients as well, for decongestion patients. For stage 1 through 4 of kidney disease, standard protocols can be used with the exceptions of dialysis. It's hard to monitor those patients. And with patients on the dialysis, testing should be done on days when dialysis is not performed. And when you're doing the graded exercise testing, blood pressure should not be checked on the same arm as the dialysis is used. Intravenous fistulal is used. Some dialysis patients, ambulatory peritoneal dialysis patients in particular, have the fluid, and it can cause discomfort during exercise. So that should be contraindicated if they feel any, or should be, exercise testing should be stopped to feel any different discomfort. Most of your patients come in deconditioned, so treadmill and leg ergometer protocols have been used on most patients with kidney disease. You can use a modified Bruce protocol, bulk, or starting out on the bike or leg ergometer should be somewhere between 20 and 25 watts, with the rate increasing from 10 to 30 watt increments every 1 to 3 minutes. Also, with hemodialysis, patients shouldn't be tested greater than 75% of their age predicted maximum heart rate. Also, make sure you're using an RPE because heart rate is not a reliable indicator for exercise intensity on these patients. Isotonic strength testing should be done using a 3 rep max or higher load. For example, 8 to 10 rep, 10 to 12, 12 to 15 rep maximum, and 1 rep maximum is not is contraindicated for a general rule for anyone with any disease. So you can calculate the 1 rep max from these other numbers. Muscular strength and endurance can also be safely assessed from using isokinetic diameters, employing angular velocities of 60 degrees to 180 degrees per second. For patients with low functional capacities and with an estimated exercise capacity lower than 50%, traditional testing may not be used. So anything that you use for older adults, deconditioned individuals should be used. And these can be anywhere testing your cardiorespiratory fitness level, your muscular strength, balance, and flexibility. Anything like sit and reach, 6-minute walk test, chair sit to stand, any of that can be used. Okay, we've reached the fit principles of exercising for a chronic kidney disease patient. Um, as the paper says, the aerobic frequency, the aerobic exercise is 3 to 5 days a week, and resistance is 2 to 3 days a week. Um, yeah, that's really good. The intensity is going to be a moderate intensity for the aerobic exercise, so it's going to be 40 to 60% and of your VO2 reserve and or your heart rate reserve and RPE scale of 11 to 3 on a 6 to 20 scale. So about 50% on the RPE or a little more, 50 to 60. Resistance is going to be 70 to 75% of your 1 rep max, and that's a calculated 1 rep max. Once again, we're going to do. I always just use a general rule of 3 to 5 rep max. I just can't um, stress that enough. Time for your aerobic exercise is going to be 20 minutes, 20 to 60 minutes of continuous activity. And if that can't be reached, it's just like anything else. You can modify it by uh, 3 to 5 minute bouts of exercise until they reach the 20-minute and progress up to the 60 minutes. Then resistance training is a minimum of 1 rep, one set of 10 to 15 repetitions. And you could choose 8 to 10 different exercises of major muscle groups, and flexibility should be encouraged as well. So it's going to be, you're going to do that during your warm up and cool down, your flexibility, and the type for these patients is going to be walking, cycling, or swimming. Um, Swimming, just remember you can't monitor these patients doing that besides outside of being right there watching them. Um, Cycling and walking them, you can, you know, hook them up to more of a telemetry type machine and can watch them. Uh, for resistance exercises, says machine weights or free weights, but I would use a progression protocol on this and start with machines first after testing them and see how they can do and see how their functional capacity is, and then going up to free weights. And also, let's remember David's little part of fit is his E. Make sure they're enjoying what they're doing, because they will be happy and progress a whole lot quicker if they're enjoying what they're doing. So here we go. Special considerations of a patient with chronic kidney disease. The clinical status of the patient is very important since it changes from day to day, or could change from day to day. So making sure that you stay in constant contact with their nephrologist or family doctor and them as well. Um, Progression needs to start out very light and be slow, uh, with greater increases in volume over time. This is depending on the clinical status and the functional capacity of the patient. The ACSM recommends starting out at 30 to 40% of VO2 reserve or heart rate reserve for as little as 10 to 15 minutes of continuous activity. But we know these patients have a hard time doing continuous activities, so bouts of 3 to 5 minutes of continuous activity is perfectly okay until they progress up to this 10 to 15 minute bouts, and then we want them to progress up to 20, 30, 60-minute bouts. But we need to be start out slow and progress slow. So this disease probably didn't happen overnight, so we're not going to increase the intensity overnight. Also, individuals with this disease when performing resistance exercise should be asked to perform at least one set of 10 repetitions at the 70% 1 rep calculated max twice per week. And then we can go up in weight or resistance when they've reached 15 reps at that weight. Consideration for hemodialysis. Exercise can be performed on non-dialysis days and should not be done immediately after the dialysis session. So just skip those days if you can. If exercise is done during dialysis, exercise should be attempted during the first part of the treatment, and so to avoid hypotensive episodes. Once again, like I mentioned earlier in the presentation, during these times of exercise, RPE should be emphasized over heart rate, since heart rate is not reliable. Patients may exercise with the arm with the atriovenous access as long as they do not directly rest weight on that area, and measuring blood pressure needs to be not on the same arm as the atriovenous fistula. It can skew the reading. Peritoneal dialysis. Patients on a continuous ambulatory peritoneal dialysis may attempt exercising with fluid in their abdominal. However, if this produces any discomfort, they should be encouraged to drain the fluid before exercising. And then patients with kidney transplants, even if they are rejected, can continue exercise prescription, but should be at a reduced rate. Well, we've come to the end of the presentation, so we're going to finish it up. Just to do a little review, bottom line is most of your chronic kidney disease patients are going to be deconditioned individuals, depending on their age and disease status. They're also, it's ACSM deems exercise to be safe. And I deem exercise to be beneficial with, among others, with kidney patients. And the benefits are improved musculoskeletal function, better blood pressure control, improved muscular strength, lower levels of the blood fats, which is cholesterol and triglycerides, better sleep, better control of your body weight. These are benefits we all benefit from exercise. We should be doing it, and also we should be enjoying what we're doing. Don't forget to have your doctor's supervision with exercise testing, and the test should be probably functional if graded exercise testing is just not working. Also, there is a last page of the presentation. It's some really cool websites and references from what I got this information from. Thank you, and I hope you enjoyed the presentation. Once again, my name is David Whitesides, coming to you from Lenoir-Rhyne University. I hope you enjoyed and learned a lot from my presentation today. Thank you.